Broadcast is now starting. All attendees are in listen-only mode.
Hello, this is Jennifer Lisanti, the Director of Sales at Beere&Purves. Thank you very much for joining today's webinar. First, we want to certainly say that we hope that you, your family, colleagues, clients are all well. We know this is a very stressful time for everybody, both personally and professionally, and that everyone's juggling a lot. So I assume that none of us ever expected to be in this situation before, and that we're all desperately wanting to know how long we'll be in this situation. And on top of that, all the information is changing very quickly, whether it's about the virus, legislation, carrier information. And during all this time and stress that you have on yourself, your clients are relying on you more than ever. So that's why we have this webinar today, to hopefully help your clients as much as possible at this time. A couple of things before we get started. Everyone is on mute. If you have questions, we would love them. Just type them into the chat box. If we don't get to them at the end of today, we will definitely circle back to you. And we will be sending a copy of this presentation and the recording out to everyone that attended. So I will go ahead and show you the agenda for today. We're going to touch base quickly on the B&P Operations. We're going to cover all the carrier information that everyone's been asking us for, recent legislation, and resources. So I do want to address that the carriers have been bombarded with questions, and their first priority, of course, was to take care of their members. So they were very good and very quick about getting the information out as far as members. And we're going to be having a webinar tomorrow consolidating all that information for you. So that will be tomorrow, Thursday, March 26th at 10 a.m. Today, we're going to be covering information that you're getting from the groups themselves about the group versus actually the level of coverage for the member. So we had a webinar yesterday and we covered a lot of information, but we've received even more additional information that we've included in today. So if you did chime in yesterday as well as today, the webinar will be a little bit different, just more complete with information. And we started asking our carriers questions on Sunday, March 15th, and the real answers didn't start rolling in until Friday, March 20th, and they're continuing to roll in. So we will keep you posted as the information becomes available to us, certainly. So I do want to talk about B&P's operations. Sorry here. Okay. So for an update on B&P Operations, we, just like everyone else, is currently working from home, and our sales reps are available just like always. Usually they're out and about in your offices, giving you updates on our carrier information, helping you with enrollment meetings, etc. And nothing has changed in the sense that they can still help you with those things once you have time and the need. It'll just be virtual, clearly. So we've implemented a couple tools for them. One is Calendly, which simplifies scheduling their time with you, so you don't have to kind of go back and forth on emails and phone calls and setting a day and time that works best for all parties involved. You can just quickly see their availability, day, time, set the length you're looking for, etc. So it's just trying to make it simpler because you have enough on your plate right now. And then we are using GoToMeeting that will help you screen share, talk to the reps, etc. Again, whether it's a broker update, whether you want to have a follow-up meeting to this webinar, as far as what all the carriers are doing, and ideally enrollment meetings. So if you have any questions on that, please let us know, but nothing's really changed on how we're operating. We have everyone working at home and just keep operating like you always have, send to the same contacts, and everyone, everything's being looked at and responded to. And we really haven't seen a delay in operations from the carriers or ourselves, certainly. So moving on to the bulk of today's presentation, which is about how are the carriers handling all the employer questions. So big picture is that, again, we're going to have the webinar tomorrow, the 26th at 10 to cover how the benefits are really covered. But big picture is, yes, the testing for COVID-19 and any related office visit, whether it's in the urgent care, emergency room, telemed, etc., is being covered really by all the carriers at 100%. The member has no out-of-pocket costs, and that includes HSA members. If you haven't heard, the IRS is allowing COVID testing and the associated office visits, et cetera, with that testing to be covered before the HSA medical deductible. So that's nice, definitely, for those HSA members. No one needs more stress right now by any means. And we're trying to encourage everyone to get the testing if need be. So I do want to point out that that's the testing and the associated office visits, et cetera, with that. If, unfortunately, you are affected by COVID-19 and then you need medical treatment, you actually are severe and you have to go to the hospital, et cetera, then your regular benefits fall into place. So I just want to make sure people don't think that everything related to COVID-19 is covered 100%. Your deductible, co-insurance, out-of-pocket max, all that will kick in if you need care beyond just the testing. All right, so this looks like a lot, but I wanted to summarize the status of the carrier responses to date. As I said, we didn't really start getting answers from our carriers until Friday the 20th, and we're still getting additional information. So you can see all the questions we've bombarded the carriers with to date. Aetna and UHC have completely responded with all the information that we've asked for. Anthem and Guardian are very close. They just have to respond about whether downgrades off anniversary are allowed. CalChoice and Covered California are both exchanges, private and public, and you know there's a lot of different carriers involved there. So they're at the mercy of all those carriers making their own decisions and then coming together and deciding what CalChoice and Covered California, they're deciding separately. I just putting them together in one bucket as far as the process here, that once the carriers have made their decision, then CalChoice will be able to release their information. I do know they're having their second call with the carriers tomorrow, and that Covered California is released some information, but again, they're still waiting on the full release. HealthNet and Kaiser are pending release of information to date, and along with our ancillary carriers, you'll see at the bottom, we have gotten partial information from MetLife, Principal, and VSP, and Delta's completely pending as well. So sorry, that's a lot of information, but just kind of wanted to give you a high level of who we've heard from, who we've heard somewhat from, and who we're still waiting on. I do know Kaiser's about to release their information here very soon, so we'll get that out to you as soon as possible. So moving on to the first question. Thank you very much. We're still getting a lot of business in for April, and the questions that were coming through is, hey, everyone had to scatter to working from homes. Not everyone is able to work from home, et cetera. I'm submitting a new group to you, and we're having trouble collecting all the enrollment material. So will there be some leniency there? So the carriers are considering that, and I want to point out that Aetna is usually very strict on their deadline, and it has been for quite a while. They needed all the enrollment material, complete submission by the effective date. So if you were going to submit for April 1, you needed to submit everything by April 1, which is very unusual. They just announced late last night that going forward, until we're told otherwise, they're going to be more in line with the other carriers. And they're stating that if you're submitting for April 1st, you can give us everything by April 5th. Anthem is a one carrier that's come out and has said we will officially extend our new business deadlines for both March and April to the end of that effective month. So again, for one business, we don't necessarily have to have everything until the end of April. We all know, because we're in the industry, it goes much better if you submit this stuff sooner rather than later, get those people in the eligibility system, including RX, especially at a time like this when those services may be definitely needed. You want them to have a smooth transition to Anthem. And so they officially extended their deadlines, but sooner rather than later, as always, is our policy. Guardian is the only ancillary carrier that's extended their deadline for April 1st. You have until April 15th to submit everything. The caveat is, if you're selling life and disability through Guardian, they're going to want a letter from the employer that states there are no pending claims that they're aware of. You can't wait until April 10th, find out you have a claim, and then want to enroll last minute with Guardian. So that's what they're stating there. And they are also adding that the 401 rates are good until June 1st. So if you just want to wait and delay the effective date to say May 1, that's completely fine as well. The other carriers have said we're not officially extending the deadlines, but have told us we can call them for some flexibility on submissions if need be. That's CalChoice, Principal, and United Healthcare. And you'll see that Principal's even added that they may be lenient on required signatures and may be following up later for additional signatures if needed, if they didn't get them initially. So that's nice to hear. So on that same topic, as it is hard to gather all the documentation normally, much less right now, I just wanted to remind you that Beere&Purves has BP Enroll, which is a free online initial enrollment system that can help you collect all the employee apps and waivers for the new carrier you're moving to. We can set it up for you. All the employees get an email, they enroll, or they waive, they can see what the benefits are, contributions are, etc. And then we can see who's enrolled, who hasn't, who we need to follow up with. Then we can pull it and we can process it on our end. And when you do it online, it's always more complete, legible clearly, and we can get that group approved even faster than normal. So just a quick reminder on that. Let us know if you have any questions. So now we're going to move on to another question, and this is more medical insurance related, and it's, are carriers going to offer a special open enrollment period? And it is true that yes, some of our carriers have officially said, if you have a group that is offering either Anthem or United or Covered California, and you had people that waived for whatever reason, maybe it was too expensive, maybe they had coverage elsewhere, maybe they just declined coverage and there was no real reason. Anthem and United are both stating there's a window that those declinations and waivers can come onto that group policy. So Anthem is stating if those folks come on between March 23rd and April 3rd, they will be effective April 1st. And United Healthcare is very similar. It's March 23rd to April 6th. United is stating that they will need to see some documentation that if you're enrolling an employee during the special open window, that that employee actually works with the employer, meaning payroll to prove that they're tied them to that employer. You're not just enrolling, your long lost aunt or something. But it's nice that they've had that flexibility. So it's definitely people now, when there's a crisis, they realize the need, and maybe they didn't take advantage of it initially, but this is an open window for Anthem and United. Again, effective April 1st. Now, Covered California is doing the same, that if you have employees that previously waived on a Covered California group policy, they can now enroll, and they're going a little longer. They're stating they can enroll up until June 30th. We are confirming, but my understanding is if you enroll in April, it'll be effective May 1st. If you enroll in June, it'll be effective June 1st, etc. But they're going a little longer than Anthem and United. Aetna is the only one that's officially said they are not offering a special enrollment period like we just discussed. And we just don't know whether CalChoice, HealthNet, or Kaiser will be doing something similar. We will let you know as soon as possible. Okay, moving on to another very hot topic. We've been bombarded, starting definitely a week ago, with everything going on. We work with small employers, and these small employers sometimes have cash flow issues. And is there any leniency on paying premiums? They're going to be a longer grace period. Well, the state of California, the insurance commissioner, on March 18th requested that insurance companies give a 60-day grace period for premium payment versus a normal 30 days that's typically in play. Now, be aware, most of our insurance companies are actually regulated by the DMHC, not the Department of Insurance. And this was a request, not a mandate. And then there's some controversy on what they can request or mandate. So when it's all said and done, the carrier at this point seems to be the one deciding, and all the carriers are evaluating. But you will see Aetna, Guardian, and Principal have officially come out and said they will give a 60-day grace period. So that's Aetna, Guardian, and Principal will give a 60-day grace period. Be aware with Guardian, they're saying, hey, you have 60 days to pay, but they're going to hold claims until payment is paid, and then they'll process claims, which I think is fair. So once you've paid the premium, they'll pay the claims for those months that you paid for. Kaiser this is an answer we do have from Kaiser so far, and they will not term groups due to late pay for the month of April. That may be extended as time goes on. Again, none of us know how long this is going to go on, unfortunately. So Kaiser has definitely come out and said for the month of April, we will not term anyone due to late pay. The other two, Anthem and United, are handling it on a case-by-case basis. So this is not from them, but I'm assuming if the group is normally in good standing, they've always paid their bill every month, and they are in an industry clearly hit, which of course is most industries right now, that there might be some leniency with them. If it's a group that always has struggled paying their bill, and or maybe if you're more of a white collar group that is working from home, and maybe you're a company that's actually coming up with a vaccine for COVID-19, that you might be able to pay your bills. So again, it's case by case with Anthem and United, just have to contact them. We just don't know yet from the other carriers listed on this last bullet point. CalChoice, Covered California, HealthNet, oh, I'm sorry, Kaiser did tell us, so it shouldn't say Kaiser there, I apologize. Delta, Choice Builder, MetLife, and BSP. This slide is just a quick reminder that all of our carriers allow employers all the time to go online and pay, because some of these groups are saying, hey, I can't get to the office where the checkbook is, I don't want to be out in public more than necessary, can't get to the post office, etc. So everyone can pay online. So this is just quick links on which carrier, how you get there for each of our carriers to the employer portal. Okay, another very hot topic is, what will carriers do if I have employees that are normally full-time and drop to part-time, or I furlough them? And this slide is just addressing, in general, as long as the policy remains in play, meaning there's one employee that's active and there continues to be health benefits for the whole group. If you lay them off, but you don't tell the carrier, they don't know. This is not an official response from the carrier, clearly. But as long as the premium is paid, they're going to have medical coverage for those people that are active on the policy. Now, we know in the industry, but it's a good reminder for your clients to remind them that if there are no active employees and the policy is terminated, then unfortunately, CalCobra and Cobra are not an option for that group. There has to be a policy to extend off for CalCobra and Cobra. But to get to more specific, how our carriers have responded to this, Aetna, Covered California, and BSP have all stated, look, this is not a policy that the carriers police. It is up to the employer. If the employer leaves them on as an active employee, if they've reduced hours or furloughed them, but they continue to pay the bill, there is coverage. We're leaving it up to the employer to decide. Anthem and United Healthcare, because of the COVID-19 pandemic, have actually officially come out and said, we are relaxing our normal rules. So they're stating, up until May 31st, as long as there's no discrimination and you're paying the premium, they will continue coverage for employees that have either been reduced hours or furloughed. Guardian is stating they will do so as well up until April 30th. And I'm sure these dates will get extended. Hopefully they won't need to be, but if need be, this is just the initial response from all these carriers. So Guardian is saying they will extend it except for disability coverage for STD and LTD. Again, you have to be paying the premium by the grace period, but they will extend it if you do. If the employer doesn't want to extend, they don't have to. Again, Guardian saying it's up to the employer. We'll allow it if the employer wants it. MetLife has come out and said, effective March 1st, we will allow approved leave of absences for 60 days, again, assuming the premium is being paid. And Principal, they too are stating coverage will continue, assuming the premium is paid. We're still waiting for CalChoice, HealthNet, Kaiser, Choice Builder, and Delta on that one. Okay, question has gone out, will the carrier allow a group to downgrade benefits off anniversary? And we don't have a ton of responses on this one yet. Aetna says it'll be a case by case. Covered California says employees can move among the plans offered by the employer at their last anniversary date. So if the group offers 3 plans, the employee can move amongst those 3 plans that are offered. And they're going to allow that up until June 30th. So Covered California has a longer date than everyone else. Principal is allowing downgrades. UHC is an exception basis, so you'll have to contact them and see and walk through that. It's not a guarantee. And then we're pending responses from the other carriers you see there. I just want to remind people that when you change benefits mid-year, especially on the medical side, there's a need to send, that's called a material modification, and you need to notify employees. That is a 60-day requirement. There's some thought in the industry that if you offer 3 plans at the last anniversary date, and those employees were told about those 3 plans, and then mid-year, you're able to switch among those 3 plans, those employees are aware of those benefits. So nothing's really changed. So would a material modification apply? I will let you know how that plays out, but that is the thought that as long as you're moving to a plan that was offered at the last anniversary date and the employee was aware of it, that the material modification wouldn't apply, but we'll see. All right, how are carriers handling rehires? So Aetna's officially come out and said as long as they're rehired within 1 year, they will waive the waiting period for that new hire. Anthem has officially changed the rehire policy up until May 31st. If they're rehired by May 31st, they too can waive the waiting period. CalChoice's normal rehire policy is listed here. They have not responded with if they're going to keep this or change to something like Anthem did. And then Covered California says, look, we go by what the employer tells us. If the employer sends us an app and says they're effective on X date, we're going to put them on the plan effective X date. So be aware of that. Moving on to additional carriers, Guardian said it's the employer decision. If they'd like to waive the waiting period for new hires, they will do so. They do just ask that if you're going to rehire 10 people, to send those 10 apps in at once versus kind of one at a time. I'm sure there's going to be a lot of processing with terminations and additions, et cetera, throughout this whole COVID-19 situation. So it's just trying to make it easier on them as far as just operation-wise. HealthNet's normal rehire policy is just listed here. We'll see if they keep this or change it. And same thing with Kaiser. This is just their normal one. If you rehire anyone within a year, they'll just be effective the first of the following month. MetLife has come out and said that as long as you rehire within 6 months, you can waive the waiting period. And then UHC says they too will waive the waiting period for new rehires. And they don't have a date tied to that. And then you can see who we're waiting on for official responses. All right, so the last slide I had about the carrier information is some things that some of the carriers are doing that are a little unique. And Aetna gives an EAP to some groups, not the California Small Business Medical Plans. So what they're saying is in this unusual time, Aetna is going to provide a free EAP program to all the Aetna groups. And the number is listed here for the employees to call as well as the employer. United Healthcare is actually giving a free EAP to anyone. You do not have to be a UHC member. So this is something they're going above and beyond, providing an EAP to anyone that calls in on this number at this stressful time in everyone's world. And UHC is giving updates on weekly calls. There is a reminder, however, that all Anthem and UHC California small groups, medical members, they always get an EAP. So Anthem members always have an EAP, and so does UHC. It's just UHC is extending it to anyone, and Aetna is extending their EAP program to the California small businesses, as well as all the other Aetna clients. So that was all the carrier information that we've been hearing from our groups, our brokers, about the questions the groups have been asking them. And so now I'm going to move on to some legislation. Now, we probably have all heard today, the third federal piece of legislation is close, we think, to being signed. So we will see. It should be done here the next couple days. And it would be the third piece. I want to remind people that California, so our local state legislation, Governor Newsom came out on March 12th and said he's going to waive the waiting period for both unemployment and disability for Californians who lose their work because of this outbreak. So what that means is you do have to apply for unemployment insurance if you lose your job. And it does take time for the state of California to process those requests. And you can imagine there's going to be a lot of requests. But when it is processed, which probably takes about 14 days, you will get payment for 2 weeks. Before this outbreak, you would have gotten payment. There would have been a 7-day waiting period, and then you would have been paid for day 8 forward, if that makes sense. So just the waiting period's been waived. You'll get more money sooner, but you do have to be realistic that it has to be processed and sent to you. Okay, now we're switching conversation to the federal legislation. This was actually the second piece of federal legislation that went into play, but it affects our employers. So we're going to cover it today. It was signed into law on March 18th, and there's 3 buckets that we're going to address. It expands benefits for paid sick leave, emergency FMLA, and it too expands unemployment insurance. So covering the first topic, which is emergency paid sick leave, I'm going to speak to groups that are less than 500 because B&P sells 1 to 100 with all of our carriers, and we sell 101 plus with Anthem Large Group as well as HealthNet. So what this emergency paid sick leave is doing is they're saying for small employers, you have to give paid sick leave to full-time and part-time employees. If they're full-time, it's an additional 80 hours than you normally provide, you the employer. And for part-time, it depends on how much they work in an average 2-week time period. It will be available immediately on April 1st, and it does not have to be accrued. So they can take it as April 1st if they're out because they're sick. They're developing some, information for employers and what they have to post if anyone could ever get to the office, of course. And there's circumstances that this applies to, and those circumstances are here. So there's 6 of them. And if you look at these, there's kind of 2 buckets. One is, are you the employee affected? So are you bound by a quarantine by the state or the government? Are you bound by a quarantine by your medical provider? Or are you actually sick with COVID-19 and seeking medical help? The bottom 3 are if someone, you're taking care of someone that's either at quarantine because of the government, your kids are out of school, or a similar situation. So this is kind of more like a secondary benefit, think of it that way. So the way it works is for the first 3 where you, the employee, are actually taking care of themselves, you get a benefit rate of $511, or it's up to $500, I can't talk, $511 per day and $5,110 in total. Now, if it's for the secondary type benefits, it is a lower benefit and the employee is paid two-thirds of their regular pay, up to $200 per day versus the $511. So the employer does need to keep track of this, and there will be quarterly tax credits for the employer to help pay for these benefits in these situations. And so it's going to be applied to the Social Security taxes that the employer usually pays. They'll see credits towards that. And you'll see that it is up to the normal benefit. What the employee gets is what the tax credit is that the employer can pay up to. Now, the 4th bullet point is very interesting for a lot of people. So we're waiting on the Secretary of Labor to decide if this applies to groups under 50, which I know a lot of groups that we work with are under 50 employees. So healthcare providers may be exempt, and small businesses with fewer employees than 50 may be exempt, but there's no information on that yet, so just sit tight on that. And this paid sick leave goes until December 31st. All right, now I'm switching gears on you. We're going to go to the second bucket of the FFCRA, which is the Family Medical Leave Act. So if you look here, again, I'm going to speak to groups that are fewer than 500. When we normally think of FMLA, we think of groups of 50 or more. So the verbiage is different with this legislation. And it applies to anyone that's worked at the company for 30 days. Where the sick leave was for anyone immediately, this one, they would have had to work for you for 30 days in order for this to take effect. And what happens is if the employee can't work because they're taking care of their child because their school is closed, then the emergency FMLA kicks in for these small employers. So traditional FMLA is unpaid. This one is paid, not for the first 10 days, but beyond that. So after 10 days, the employer has to pay the full-time employees no less than 2/3 of their regular amount of pay. And part-timers, you have to look at the average that they've worked. You'll see that the benefit is capped at $200 per day and $10,000 in total. So just like the sick leave, the employer can take a credit upon their Social Security taxes. When an employee is out because of FMLA, you do have to keep their job available to them or an equivalent. But look at the 3rd bullet point here, and now we're talking about groups less than 25 employees. You don't have to keep their job available or an equivalent if you couldn't because of the economic conditions of the situation. So that is a little caveat for the smaller employers. Like the paid sick leave, I think I actually just mentioned this, that there is going to be a credit applied towards Social Security taxes for the employer so that the employer can be reimbursed or get a credit for the money that they pay out for this emergency FMLA. All right, the 3rd bucket is unemployment insurance at the federal level. So what the feds have done in this FFCRA legislation is put $1 billion aside in grants for unemployment insurance. And 50% of that bucket is going to be helping states with the administration cost of processing all these unemployment claims. The other 50% will go to states where there is a 10% increase in unemployment that they can help pay for the claims. This provision goes until December 31st of this year. All right, so that's the content. I do want to show you a web page that we have on our website that hopefully will help you at this time, because again, as I said, the information is moving clearly fast and furious. And so this is our website. We have a COVID-19 carrier responses page. And if you go down on this page, you'll see our normal little tabs over to the right for each of our carriers. So you can hit, Anthem, and it slides directly to the Anthem information. This information is being updated constantly as the carriers are releasing more information. So this is a best source, but definitely just hit up your sales rep or team and ask them if there's any information. We will continue to send it out to you guys as well, but this is also a great source. So let me take a second real quick and go to any potential questions. If you do have questions, if you want to type them in, that would be great. Let me see if I can take a look at them real quick. Oh, good question. Our brokers paid commission on COBRA, and I know during the 2008 financial crisis that was definitely something that came up, and some carriers did and some carriers didn't. So thank you, that's a good reminder. We will look into that and let you know on that one. But again, if they go back to what they did in 2008, some carriers did, some carriers did not pay brokers on commission on the COBRA members. Okay, thank you. It looks like there's lots of questions coming in, so let's see. Yeah, so the question is going back to, my client just doesn't have the money to pay for the premiums, and they can't afford it since their business is closed. Are the carriers offering any relief? In general, it's case by case. Most of them are saying they'll give a longer grace period than needed, but no one has come out and said, yeah, we're just gonna let you go a couple months and you don't have to pay us premium. No one has said that. Let's see, sorry. Trying to glance at them real quick without making you guys wait too long, so I apologize. And we'll definitely circle back with everyone and get the answers if we don't get to them today. The question is this information applicable to large and small group? And yes, well, we sell Anthem large group, and the information is the same for Anthem small group and large group. So I guess I should just stick with that carrier. But I think in general, it is corporate wide. Actually, I backtrack. We don't sell UHC large group, but the information is the same for UHC small group and large group. The only difference we've seen is whether it's self-insured or fully insured. So just keep that in mind. We will be sending out copies of these slides. That's on here a couple times. Yes, question on telehealth. We have a lot of information on telehealth. We're going to host a webinar tomorrow on telehealth with each of our carriers and the additional benefits that our carriers are providing at the member level. But if you go to this webpage that I think you can see right now, the information, most of the information is there right now. But definitely a hot topic. And just so you know, I'll just go ahead and say it. For example, carriers like Anthem and United have announced that since they're trying to encourage everyone to stay at home and not go to just their regular doctor's visits, that if your normal doctor can do a telemed office visit with you, they're going to let your normal doctor bill for an office visit, even though it was telemed. Usually you have to use their vendor like Life Health Online with Anthem or etc. They're actually going to, because of this unique situation and trying to encourage people to stay out of office visits, let your doctor, if they have the capability to talk to you and actually do an exam with you, to bill for that. Okay, let's see, start going down. Lots of requests for the presentation. We'll definitely get that out. Again, kind of a question on large group, small group, I can answer that. I know with Anthem and United, the answer is the same for large group and small group. Okay, I think I've hit most of the questions without making you guys wait too long. And again, we'll circle back, not to leave anyone hanging clearly. So I think that's, we'll end our presentation today. Again, we will send the presentation and we will, once it's complete with all the carriers, we should have Kaiser's information very soon, along with, I know, Cal Choice. And I would just like to remind people to, in this time, definitely listen to the experts, the CDC, the California State Public Health, the local public health are good, especially local sources, because as we know, different parts of the country are working differently right now. And do whatever you can do to stay well and calm, and let us know what we can do that to help you, at least, on the business side, helping answer questions, take care of your clients, whether it's new business, renewals still are going on, all the uncertainty. We're here to help, and we appreciate your partnership. And just let us know if you have any other questions that you want answered that we didn't address today. Definitely open to doing more webinars or making sure that we're taking care of your needs. So take care and be well, and thank you for your time today.